I'm Ricky Bevington, host of All Things Considered on Georgia Public Broadcasting. This is the What You Need to Know Coronavirus web series from GPB. Joining me via Skype is Dr. Chirag Patel, Medical Director of Population Health at Wellstar Health System. Dr. Patel is on the front lines of how coronavirus is playing out inside clinics and urgent care centers in Georgia. Before we get started, Dr. Patel, I want to illustrate the kind of view you have. There are 11 Wellstar hospitals in Georgia, hundreds of clinics, and you're getting information from all of these sources. So you really do have a broad view of what's happening. So first of all, thank you for joining me.
Good to be here.
The new data point that we have today is that 40% of those hospitalized between the ages of 20 and 54. That's not a senior's disease as we've been hearing. Is the going messaging now from doctors that we should all, of all age groups, be acting like we have coronavirus?
I think it's important to take that data point in context. What's important is that the ages between 25 and 54, those patients can become seriously ill. If you do end up having symptoms that are outside of what you would consider a flu-like illness, definitely seek advanced care, go to a hospital, go to the emergency room, go to your urgent care. But before you do, call them. Let them know that you're coming. That way they can prepare for you. That way you don't expose anybody else or put anybody else at risk.
Coronavirus is the virus that causes the disease COVID-19. What does it feel like to have COVID-19?
It can feel anywhere from having a mild flu-like illness all the way to respiratory failure and then ultimately death. It's a very serious illness. We do see it. Most young people do very well, but there is new data like we just talked about that middle age group, that severity of illness may be more severe than we previously thought.
If people think that they have symptoms, what should they do?
I think definitely think about which symptoms you have, categorize them in your mind properly, and then call your primary care physician or your healthcare provider to figure out what the next step in the process is. It may be that you do need to go to the urgent care or see a primary care physician or go to the emergency room, but this gives everybody an opportunity to prepare for you.
I was walking by a restaurant yesterday and it was packed. I mean, tables of 12. This restaurant was really bumping like nothing was going on. What is your message for people who are still going out?
Yeah, I think this is very serious. I think this is an opportunity for people who are out there and about. I'll take the assumption that these are mostly young people to do their part. You know, everybody is going to have to do their part. This is going to be a team sport to get rid of the COVID virus in our country and our communities, and we would expect that they would do their part in social distancing, in hand hygiene, in population health interventions to flatten the curve, if you will, around the propagation of this disease.
For somebody who may have mild symptoms and then they get worse, how are you helping people kind of get through that fear? What advice do you have as a doctor if I'm feeling really terrible to help me get through this fear right now?
So I'll put it into two different buckets. If you have a mild illness and your fear is anxiety based, definitely there's a process for us to walk you through alleviating your anxiety, because there is a lot of that going on too. But if you truly have a worsening of your symptoms, worsening fever, worsening nausea, vomiting, diarrhea, you need care. You need to accelerate your health care, and we will definitely get you to the right place. We are ready to do that.
Dr. Chirag Patel is with Wellstar. He's also a pulmonologist, which comes in handy. Thank you so much for joining me.
Of course.
And the GPB News team is working around the clock to keep you informed on everything happening with coronavirus and COVID-19 here in Georgia. Check out our website at gpb.org/virus.